We have a surgery center here, which we're going to have the doctor explain to us, is doing amazing things in providing service at a fraction of the cost, quality service that people are coming from all over the world and all parts of the country, all 50 states, to have surgery done here in Oklahoma City. So, doctor, it's a pleasure to be here, and you've been doing this here now at Surgery Center for how many years?
We've been open 17 years this May, and we've been quoting prices from day one. As one of the reasons we opened our facility in the first place was we wanted to be honest in our pricing, and we knew that that was not the prevalent mode of operation in healthcare. So from the very first day, we would quote prices if people called and asked, how much would it cost to have my hernia fixed, and I would just call the surgeon and ask him what he thought was fair, and we would quote prices over the phone, not knowing at the time how radical really that was. And it all culminated about 5 years ago in us just deciding we would put these prices online, knowing that the healthcare industry in this country was not a result, and the pricing and the quality was not the result of what we would call the free market. It was much more like a cartel or a syndicate with price fixing and deals that were made where patients wound up in doctors' offices or hospitals, not necessarily because that was the best place for them, but it was the best decision for kind of the people behind the curtain making the money. So when we put our prices online, part of our thinking was we wanted to expose this scam, and as big fans of the free market, we want people to really know and understand that the failure of the American healthcare system is no failure of the free market. It's an absence of the free market primarily. And what you said in the very beginning is so true. What we're doing here should not be that remarkable. What we're doing is what every other industry in the United States does that operates fairly. We say, here's what we do and here's how much it is. We identify our costs, build in a marginal profit, and then display those prices. And that's how every other industry works, and it promotes healthy competition and keeps quality high and prices low. And that's basically how we operate here.
As opposed to what is the usual experience, people just go into the hospital or go into the doctor, they have no idea how much it's going to cost because insurance is going to cover it, but it doesn't, and insurance rates go up. Out-of-pocket expenses and deductibles keep increasing. So I was on your website at surgerycenterok.com, and there are a number of examples there of people who are giving their stories. A young man, I believe it was, who had to have a broken nose or nose problem. It was going to cost $20,000 was the quote at the hospital. You folks were able to do it for a tenth of that, for $1,900. Many examples like that, but as you emphasize in your blog, that some people think that the price differences are so radical that there must be a quality suffering there, but that isn't the truth.
It's not the truth. In a normal market economy, you can equate, in most instances, price and quality. There's a relationship that's linear. In healthcare, because the free market is largely absent, it's not a healthy market economy. So the relationship between price and quality is not what you would think. It's actually inverse, because what happens is where you encounter high prices in healthcare, you typically encounter the monopolistic, syndicate, sort of cartel practices that lead to those high prices. Those are situations where, say, one insurance carrier or one giant hospital has complete control over a region, and so they know they're going to get the patient's business whether they're any good or not. So they don't have to pay any attention to quality because they're assured of that business anyway. My saying is that competitive individuals tend to have competitive pricing. If you are a newcomer in the marketplace, or if you're just a competitive individual or a facility like this where you want to show that you are better, or you're at least as good, or you're the best, that competitive spirit lends itself toward competitive pricing. So the normal relationship between pricing and quality in healthcare is flawed, and if anything, it's inverse. The less you pay, in all likelihood, the more likely you're in a competitive environment where various people are competing for the business, and that not only lowers prices, but it keeps quality higher.
And you have, with your prices so much lower than everyone else, you still have this state-of-the-art, what, a 32,000 square foot facility?
Yes.
And top-notch doctors and surgeons here. You have how many that in your practice here?
There are 52 surgeons who work here now. I anticipate another 6 or 8 before the end of the summer. So we'll probably round out around 60 by the end of the summer.